I'm Dr. Douglas Street. I'm a general practitioner from Montego Bay, Jamaica. Today, I want to speak to you on the topic of whether diabetes can be reversed or not. Now, diabetes is what we call a chronic illness. That means that it's a long-term medical problem and normally expect to be incurable. Now, diabetes is characterized by high levels of blood sugar, and over time, this can lead to several complications, such as blindness, such as heart disease, loss of limbs, kidney failure. So, it does have a great impact on the individual, and it's also expected to have increasing numbers worldwide. Now, diabetes is considered to be a permanent and progressive condition, and this means that if you get diabetes, you have it for life, and it will usually get worse as time goes by. However, recent research has been showing that diabetes can actually improve once you take the correct steps. So it doesn't have to be a life sentence. Now, diabetes is caused by long-term inflammation. And inflammation, as has been discussed in a previous video. Now, what happens in diabetes is that, especially for persons who have a genetic predisposition, the inflammation interferes with the function of the insulin, and that causes the body to become increasingly unresponsive to the production of the insulin, and that causes the blood sugar to go up, causing that diabetes. So control of the inflammation is actually very important when you're managing and treating that diabetes. Now, recently I've written a book. It's called Beyond the Prescription: Reducing Inflammation, and it goes into the details about how you can actually reduce the inflammation. It actually shows how you can treat the diabetes by reducing the inflammation. It's available on Amazon in the ebook version and the physical version. So what we're going to be doing is looking at some of the principles that are discussed in this book. Now, as I mentioned before, it's important to have a diet and lifestyle that reduces inflammation inside the body. It's also important for a diabetic to have foods that do not have a high glycemic index. Now, what does that mean? The glycemic index is a measure of how much a particular food increases your blood sugar, right? And the glycemic index is from between 0 to 100, with glucose being 100. So foods that have a glycemic index of 70 or more are considered as high glycemic foods. Now, these foods, you may be surprised to know, they are not necessarily sweet. You do have foods that are not sweet, that have a high glycemic index, such as pumpkin and even flour. Even whole wheat flour has a glycemic index of 70 or more. So it's really not something that a diabetic is supposed to be consuming. And you do have foods that are sweet, such as prunes and sweet potato, and they have a relatively low glycemic index. So it doesn't necessarily have to be the food that are not sweet. So for further information, you can actually refer to the book. It goes into more details about that. There are other dietary practices which are important in getting the inflammation down. For example, you should ensure that your meals are properly spaced. It's normally recommended that diabetics should have 5 meals a day, with 3 main meals and two snacks. However, the more meals you have per day is the more inflammation that is produced in a day. So ideally, a diabetic should really be having 2 meals a day, not 5. And those meals should really be spaced by at least 5 hours. Right? And you can structure your meals so that you don't get hungry between those meals. And of course, the book will have information about that. You should have your major meal as your breakfast, and your lunch should really be consumed no later than between 2 and 4 o'clock. Any eating after that should really be only vegetables. Another important dietary practice that reduces inflammation is fasting, especially what we call intermittent fasting. And again, the book goes into showing how that is conducted. There are many persons who think a diabetic should not fast. However, fasting has been scientifically shown to improve diabetes over time. So it is very important that a diabetic actually fasts. There are other practices which have been shown to help to reduce the inflammation, such as exercising, and there are ways in which this can be done. And there's also ensuring that you drink enough water. And diabetics should really have a large amount of water. The book goes into more details on that. Healthy sunshine is also important, and also a temperate lifestyle. And this includes especially limiting the usage of chemicals, household chemicals. This can increase inflammation inside the body. Getting fresh air, getting proper rest, and also by having a healthy intestinal microbiota. Now, this was also discussed in a previous video. Having a well-balanced microbiota can actually improve on your diabetes. There are also supplements that have been shown to reduce inflammation, nature-based supplements, not man-made supplements, and this can also help in the improvement of your diabetes. So, in summary, diabetes can actually be improved and even reversed to the point where you can come off your medications, but you have to be disciplined and you have to be knowledgeable about what it is that you need to do. So ensure that you get the book online and practice the intervention that I mentioned, and you also can see your own diabetes or that of a loved one improve to the point where you may not need any medication. Take care.